Well, hello everyone. I'm Professor Sarah Mackenzie Ross. I'm a consultant clinical neuropsychologist and an honorary professor in clinical psychology at University College London. For the last 2 decades, I've been researching the impact on cognition and emotion of neurotoxic substances, organophosphate pesticides in particular. I am delighted to be joined today by Professor Karla Sampaio, who is a lecturer in toxicology and toxicological analysis at the Federal University of Espírito Santo. Karla has been researching the impact on the cardiovascular system and behavior of exposure to pesticides, and she's also been undertaking epidemiological studies looking at the prevalence, causes, and medical management of pesticide poisoning cases in Brazil. She has very kindly agreed today to tell us about her work. So, Karla, over to you. Perhaps you could tell us why you're researching pesticide poisoning and what the situation is in Brazil.
Hi, Sarah. Thank you very much for the invitation for this interview and the opportunity to present some of the data we have been gathering in pesticide studies, which we hope we can help the students undertaking this course. The idea of working with pesticides came from a meeting I was invited to participate by a local prosecutor. He was very much concerned with the high numbers of suicide attempts observed in the local court cases. And when looking to this case, it involved mainly farms who committed suicide by pesticide ingestion. And we looked into the main pesticides described in these records and decided to start testing some of these pesticides in animal models to evaluate cardiovascular and behavioral changes produced in these animals. The behavioral toxicity studies, they are conducted with the help of a colleague. Her name is Vanessa Benjamini. She's a pharmacologist, and she possesses the expertise in conducting studies using experimental models to investigate psychiatric conditions. And besides of different damages we observed in the cardiovascular function after acute or chronic exposure to these compounds, we observed some important neurobehavioral changes in the models of pesticide exposures. For instance, we observed that even acute exposure to pesticides leads to depressive-like behavior, progressive behavior, impairment in aversive memory extinction, and anxiogenic-like behavior in young rats. So more recently, I have been devoted to epidemiological studies, looking into pesticides poisoning related cases within the population, seeking to translate the experimental evidence we have been producing on cardiovascular and behavioral toxicity of pesticides in what's happening in the population exposed to these compounds. This work was a project of a master's degree student. Her name is Josefa dos Santos, and was conducted with the cooperation of a colleague who possesses the expertise in biostatistics. Her name is Dr. Eliana Zandonade, and with your cooperation in better understanding and interpreting the data because of your expertise in neuropsychiatric problems related to pesticides exposure. And the question is why pesticides poisoning is a problem in Brazil. Brazil used to be considered a low economically developed nation, but the country has developed so fast in the last decades that's now a major agricultural superpower. Large parts of Brazil have the perfect climate and geography for growing crops and livestock activity, such as Brazil is the biggest exporter of coffee, sugarcane, soybeans, and beef. Almost 25% of Brazil's gross domestic product comes from agribusiness. Data from the Food and Agriculture Organization shows that Brazil is one of the largest users of pesticides in the world, and hundreds of new products have been approved each year. Data from the Ministry of Agriculture showed that in recent years, we had more than 400% increase in the number of new pesticides. And also data from the Brazilian Institute for Environmental and Natural Resources shows that for the last 20 years, consumptions of active ingredients increased more than 400%. For instance, in 2021, the country reached nearly 700,000 tons of pesticides consumed. So together with the increase in consumption, there is a consequent increase in the number of poisoning cases in the country. This is also the reality of other countries that use a lot of pesticides. There is a plethora of data showing that pesticides poisoning is a major problem in low and middle income countries such as Brazil. The last data available we have from 2021, more than 10,000 pesticides poisoning happened in Brazil. So pesticides poisoning is a major health issue. We have been researching prevalence, location, and causes of poisoning by looking to the database of a poison service center in the state where I am located. And these centers have the role of providing assistance in the diagnosis, treatment, and management of poisoning cases. And we have also been looking at how individuals are treated and if they're receiving appropriate treatment. And what we found so far was more than 3,000 cases of pesticide poisoning within a 4-year follow-up, with a high prevalence in young adults in the age between 20 and 39 years old, and in young children. Attempted suicide was the leading cause, followed by accidental exposure and occupational exposure. Most of the cases survived, but many of them were given inappropriate high-risk treatment by local doctors. For instance, more than 50% of the cases received gastric lavage, which is not recommended by the Poison Service Center. Neither is in the best practice of pesticide poisoning management because of the risk of some of these procedures. And those who survive may be left with disability levels of ill and health, including neuropsychiatric problem and long-term cardiovascular damage, increasing morbidity. And we also found that more severe outcomes were observed in those who attempted suicide, came from rural areas, and involving extremely and highly hazardous pesticides, which have been banned in many countries. So that's it.
Wow.
We found so far.
That's quite a lot of information you've managed to gather there. Can I just ask, you mentioned the leading cause was suicide. Was that a surprise to you as opposed to? No,
not really. Because of this perception, as I mentioned to you, this local prosecutor had, we hadn't analyzed any data, but I expected to see that. And mainly because there is an easy access to these compounds, and the long-term exposure to some of these compounds may lead to development of psychiatric disorders. So they usually become depressive because of the exposure and then attempt suicide using the compound itself.
Mm-hmm. And it's very interesting that you've discovered that the way that they're treated is not necessarily the way that perhaps a specialist in toxicology would advise. So presumably these people, when they get poisoned, probably have to go to a local healthcare service. And I mean, what we noticed in our studies is that medical professionals in Britain don't get much training in toxicology. So they don't consider a toxic cause for someone's symptoms necessarily, and may not know how to treat them either. Is that the situation in Brazil, do you think?
Yeah, also, I think they are not aware of the best practice, and they get scared when they see someone poisoned by a pesticide and then try to do their best. But some of these procedures are very hazardous for the patient.
Mm. And also interesting that you've discovered that some of the pesticides are very high risk and that they're banned in other countries. I mean, how do you think that could be tackled? Because presumably that's quite difficult. That's to do with the government and regulatory bodies.
Yeah, exactly. Yeah, there is a big pressure on increasing agricultural production, and the way the farmers usually know how to do that is using pesticides. And also a pressure from the industry for selling more products that have been banned in other places. So it's very difficult. But I guess the more we produce data, either in experimental scenario or epidemiological studies showing the risk of these compounds, the higher the chance of banning these products.
What do you think the way forward is? What plans do you have next? What do you think we need to do?
Yeah, I would like very much that the data we generate either in the experimental scenario or epidemiological studies could be used to help these ban these highly toxic compounds. There is some studies that show that when you ban these highly toxic compounds, you don't reduce agricultural production, but you reduce the chance of worse outcomes. And I would like to help conducting educational programs for the population on instructing them on adequate use and self-protection when using these compounds. We could help also the health professionals in their training, showing the risk of some conducts, and would like very much to conduct studies either in the experimental or epidemiological, but looking into the population more affected, trying to gather more information on the neuropsychiatric and cardiovascular long-term effects, and helping gathering a team that could provide adequate assistance to them. The problem is that this kind of research requires a public investment.
Oh. Well, that's you've got a lot of work ahead of you then, haven't you? You've got things that need to happen, and I really hope that there is some way that we can encourage funding so that we can make these studies actually happen. Because like you say, there are now a number of countries around the world who are, China's another one, who are producing very large amounts of our food, and the farmers are relying more and more and more on pesticides to increase crop yields in order to meet supply and demand. And so, yeah, it is really important that we try and get greater awareness amongst both regulators and healthcare professionals and the general public about the risks involved and how we can mitigate those.
And it's important to state that the problem may be much worse than we found, because these poison centers, the report to them is not mandatory. So there might be much more cases than we found. So the situation might be much worse than we observed already.
Yeah, because like you say, it's actually quite hard to find everybody that's been poisoned. We had the same issue in the UK when we were doing our studies, trying to identify people who had been exposed, because there's not necessarily a database of that, is there? And farmers don't always report things anyway, even
exactly
have been rendered ill. So it's a challenging area to work in, but a very important one. And I really appreciate you joining me today and explaining what you've been doing and what the issues are. I'm sure the people on the course will be very grateful to you. So thank you, Karla, and all the best with your future studies. And I hope we can keep in touch.
Yeah, I thank you for the opportunity, and I hope this information is of help to the students. Thank you very much for the invitation.
Okay.